And welcome to part 2 of our Hospice Awareness Series. And we've got 2 professionals in the hospice industry along with us. We've got Rebecca Howard on the outside and Tiffany Pflasterer here in the middle to talk about the different things in the hospice industry. And ladies, appreciate you all joining us.
Pleasure to be here.
Sure. And we had part 1 with Waynetta Rogers. She's a community educator within hospice, and she talked about all of the different benefits and services and how hospice has really come along in the past years and how it's really expanded its role within the healthcare industry. And we're going to talk with you ladies about more of the personal side of the hospice. You're actually dealing with the clients day in and day out, and more of the personal side of hospice. So we're going to get your take and how hospice works and how it can actually benefit the viewers out there. So first off, maybe we can talk about, as Waynetta did in the first part, about how she really tries to, she's kind of the first step about talking with the clients or those interested in the service and just educating them on what they can provide. But y'all are actually the next step about providing the care for those individuals. So maybe just talk about that first experience in dealing with the clients and providing the services that they need.
Okay. My name's Rebecca, and I'm a hospice nurse. Hospice is a very specialized branch of nursing. You're dealing with patients and their families at a very challenging time as they're dealing with maybe a new diagnosis or just the realization that, there is no further aggressive treatment that might make a positive impact, as it relates to their disease process. So when they do finally come to that decision, that point in their decision-making process where they do accept hospice, it can be very challenging. But as a hospice nurse, I have to say it's very rewarding and very gratifying to be involved with someone and their family, with that patient and their family at a time when you're dealing with some very challenging issues. Hospice is a very different focus, as you might imagine, than maybe the hospital acute care or subacute, as our focus is more symptom management and comfort, as opposed to a more curative approach, because obviously at the same time we're trying to keep someone as healthy as we can for as long as we can, and keep them functioning at the highest level we can for as long as we can, despite the fact that they do have a life-limiting or an incurable disease process going on.
And when you say incurable disease, I know that's a wide range. That's a very wide spectrum of what that entails.
It is, and some of the most common, and Waynetta may have touched on this as well, especially in this area of the country. I think it probably differs in different areas of the country, but probably the top 3 diagnoses that we deal with at our agency is COPD, which is chronic obstructive pulmonary disease, CHF, congestive heart failure, and Alzheimer's. That kind of makes up the bulk of our census at this time. There's many other incurable diseases, chronic liver disease, kidney disease, neurological disorders like ALS, MS, strokes, things like that, all fall, under meeting hospice criteria. But a nurse, being a nurse, your focus, obviously, when you go into the home is to do an accurate, thorough assessment while you're giving the most thorough care that you can deliver.
Wide range of different things that could be going on in each circumstance.
It's true. And not only are you focusing on that patient, it's the entire family. Hospice is such a holistic approach. When you go in, you're always doing an assessment, as all nurses do, no matter what branch of nursing. And it's an assessment. You can never do too much assessment and ask too many questions. And as you identify things, the whole team approach with hospice is paramount. It's so important to get, as long as the patient and their family agree to that. We've got so many services and benefits that they can take advantage of as resources. The chaplain, the social worker, volunteers. And, if you pick up on little things, little cues, that there might be some spiritual concerns or emotional or financial concerns, you can always, in part of your assessment, then go back to the team and let them know that there are some things going on that they might want to address. So it's always that assessment and identifying things that part of your team might be able to make a positive impact and trying to resolve and so bring closure.
Sure,
So,
sure. And Tiffany, you're part of the team as well, and helping provide the care for the individuals. So, from your standpoint, and what your role is in the industry, how do you go on what she said there?
All right. Well, basically, my job is to be a home health aide. I'm an extra set of eyes for the nurses. I watch out for basically skin breakdowns, basically trouble breathing. If I have a COPD patient, if they're exerting more energy breathing, they're having more problems as we go. I basically am able to help family members adjust to becoming basically caregivers, because nobody ever realizes that caregiving is a full-time job until they actually get thrown into the position. And when then they're thrown in the position, they're not really sure exactly what to do all the time. So I'm basically that extra help to help them ease into that position. I actually can help them adjust to how to transfer somebody, how to help with brief changes. I help the patient with personal care, of course, showers and nail care, teeth care, and I help change bed sheets and things like that. So I'm just that extra set of hands to help out.
Okay, so you're really being an educational figure for the families themselves as well.
Yes. Yeah.
So it's quite a task to take on for a family that may not be in that circumstance up to that point.
Yes, sir, it is.
Sure. And Rebecca, you talked about, and we talked about this with Waynetta in the first part about how hospice has changed over the years, and you talk about incurable disease. You can live with an incurable disease for quite some time, and a lot of people associate hospice with really terminal end of day, last few days or weeks of someone's life. But how does that tie in when you can live much longer with an incurable disease? How does hospice play a role in that?
that is a huge misconception still, is hospice is concerned, because they'll say, oh, Mr. So-and-so is open to hospice. Oh, that's the first response here is, oh, I'm so sorry, But and it's a good thing, because people do need that support and specialized care and resources and the benefits there that we do provide, and it never costs anything, which is a great thing. But it was meant to be taken advantage of for at least 6 months. And I think just that people are reluctant to accept hospice because of the bad connotations that are,
More
attached.
dire circumstances.
Right.
I don't think they completely understand that it involves disease progression. Somebody's disease with COPD may not progress as much as this person's disease with COPD. It's all in disease progression, and some people are still uninformed about that.
That is true. And we don't have a crystal ball. I don't know when, you can know well, no, you don't know approximately, but as a disease progresses, as the whole incurable disease process progresses, there are certain things that you look for. And again, that's part of the whole education process too. As a nurse, any team member that's in there is constantly, every single visit, educating that patient and family about what to look for, what's going to happen, what they should do if that happens. And they know that they can call us 24/7. Hospice is always 24/7. And that gives them a lot of peace of mind and reassurance that if they do get in a bind and they don't know what to do, they can always call us. And if we can't talk it over the phone, talk it out, and they get an answer, satisfactory answer, they know that if they say, I need a nurse, we will go out. Absolutely, unequivocally, we're 24/7. And I think that's very reassuring to patients and family to know that we are there for them no matter what.
Sure. And I talked with Wayne in the first part about there's a list of diseases that are incurable that they really you all really really focus on. But if a family has someone diagnosed with one of those diseases, that they should, and then Wayne recommended this, to actually contact hospice at that point, even though it might not be a dire circumstance, but to contact them and actually seek out the services that you all can provide.
It is very important if they would do that, and that's part of our job too as a community educator, or her job as a community educator, to reach out and let them know that these services are out there and what to ask your doctor. I think people look to their providers, their doctors, their clinicians, their family nurse practitioners for answers and advice and recommendations. And I think sometimes the providers are reluctant to talk about it, assuming that people are reluctant. At the same time, they're looking to them for answers and advice. I think that's part of the whole educational process, is not only identifying hospice appropriate patients at appropriate time, but having those discussions early on and talking to people about realistic expectations when it comes to end-of-life issues. And I think if they're better educated, knowledge is power, they can, they won't be so afraid or so frightened when the time comes. So
Sure. And since you all deal with the personal side and deal with so many families each year, what's your takeaway from the families after y'all provide and come in and provide y'all's services? What's their feedback generally about what y'all have done, and what do they take away? Like, well, we should have done this. We should have. What do they have any takeaways about what y'all provide, and after y'all come and do what y'all do?
They do, and it's time after time, and I've heard this just 100% of the time. I'm so glad, the three things that we always hear. I'm so glad I had hospice. I could have never done this by myself. I wish we would have had hospice sooner. That's a lot of comments we hear too. Had I known that all this was going to be provided, we would have had hospice come in earlier. Or just that I wish I would have had hospice, period. I've run into people that try to do it themselves, and then once they find out they could have had all this, it's like, wow, I really wish I would have had hospice. But I think 100% of the time I can really honestly say that they're so thankful and so grateful to have had that support and specialized care, all those resources at their fingertips to rely on, knowing that it would have been so incredibly difficult to have done it by themselves.
Sure. And that's what your takeaway is?
Yeah, that's always positive takeaway from the families.
Okay. Because we talk about this and the misconceptions about hospice. I know there's got to be takeaways from the families about what they thought you all provided and what you actually provide and what they learned from it. So that's why I'm trying to make that segue about the viewers out there, if they were to be potential, seeking out the services of hospice, what they can actually take away from the clients that you all have dealt with and what they've taken away from the services.
I think they also take away that they don't get just our physical help in there. They actually get emotional support more than they had predicted. They actually start growing a bond with the people that come in and out of there, and I think they realize after a while into the service that it's more than just a physical, I'm getting help here, I'm getting help there. It's more of an emotional support too.
Sure. It can be overwhelming dealing with that.
It is overwhelming sometimes. We can, I think it's very important that hospice employees, nurses and aides, etc., do get proper training before they decide that hospice is for them, because you do develop those very close relationships at this particularly challenging time in their life, and it our patients don't get better. Well, some of them do. I mean, sometimes they can meet criteria and they simply do not decline, and that is a wonderful thing when we can actually release a patient off of hospice because they haven't declined. More often than not, they continue to decline. And so it is important to take care of yourself. Take that vacation that you need to take that you've earned, because you can really suffer from the burnout syndrome because our patients don't get better. So, but you have to keep it all in perspective. You
Sure.
really do. It's difficult at times.
And I would, from what the stories you all have told me and how we're interacting here, that people probably truly undervalue the personal touch that you all can provide, the personal interaction, the human interaction. That's probably a little underestimated what the value that you all provide when it comes to that. I know like you said, Tiffany, about the help here, the helping with the patient and their caretaking, but actually helping them help themselves and feel better about their position and their circumstance. That's
Absolutely.
probably overlooked quite a bit, I would imagine.
I think probably it is, yeah. But every visit you're there, like I said, you're educating and you're offering them support and just recognizing their abilities to be able to handle what they are, and just encouraging them constantly, because as Tiffany said, caregiving is incredibly tough. It's a tough job to take on.
Sure.
And that's why, respite is such a great benefit that we provide, that when the caregiver just throws up their hands and says, I can't do this, finds out that maybe they need a few days to regroup, we can transport that patient to, let's say, a contracted nursing home for a few days and let that caregiver take a deep breath and regroup and, come back and say, okay, I'm ready, I can do this again, because it becomes very overwhelming to them.
Yeah.
Sure. So, a lot of information being told here. Hopefully everyone can take something away from this series about hospice and what it can provide for families. Hospice has really changed, as these ladies have talked about in this series, and how it's changed over the years, because the healthcare industry has changed so much, and how people are living longer and overcoming so much. So it's certainly worth getting involved with an educator of hospice and just seeking out the information what is available. So these ladies have really went into what it can provide for your families in need, and just making the whole process easier when you're looking after your loved ones. Is there anything else you'd like to share that maybe we didn't touch on or want to emphasize as we end here?
Anything?
No, I think we covered it.
Probably one thing I'd probably want to emphasize is the no cost factor.
There is never a bill received.
I know
It's-
there's always reluctance in anything when it comes to money and cost.
Right.
So that should be wiped off that list when it
never
comes to
a bill. They
to-
never
to
receive a bill.
hospice.
It's based on medical need only, never on income. Some people do think that we'll take over their finances. I don't care if someone makes $3 or $3 million. We don't get involved in their finances at all.
Okay.
So if they have any questions or need additional information, they just need to call us, and we'll be happy to speak to them about anything that they might not quite understand or have had a misconception about, and we can clarify some things. We'll be happy to do that.
Sure. And we've got the number to show for you to seek more information about hospice. And appreciate Waynetta Rogers being in with our first part, and Rebecca and Tiffany along with us to talk about the more
Appreciate it. Yes,
personal side of the industry. And we wish you to seek out hospice when it's needed, or if you're just wanting more information, to seek out what's available to you. So, ladies, we appreciate you spending some time with us, and
Thank you.
Thank you
Appreciate
for
take
having
care
us.
going forward.
Thank you.